Howdy, folks. High Value DMD. Don't just give me your subscription, but please let me earn it. Let me earn your like and let me earn your comment. Be careful who you choose to be your dentist. If you don't know who I am a dentist. I graduated dental school not too long ago, and I've been practicing dentistry for the first couple months of my career. And so I am uniquely positioned to be able to comment on this subject. So what is this about a dentist advising you to be careful about who you let be your dentist? The reality is not every dentist is created equal. Not all of us are as good as the next one. I advise every single person. I've advised my family members. I live in another part of the country. I'm not able to provide treatment to my family. I advise them to carefully look at the CV of the dentist that they're looking at. You need to get their resume. You need to ask certain questions about this person that you're going to let operate on you, essentially, right? A lot of people, they want implants. They want braces, Invisalign, okay? Implants are a big one. Let's talk about that for a minute. And braces too, okay? So as the baby boomer generation is aging, people don't want dentures. They want to replace the tooth that they lost with something that is basically the same, and the answer to that is an implant. And so you have a missing tooth, and you have to figure out who is going to replace that tooth for you. Well, there's different types of dentists out there that can place implants. The dentists that pioneered the field of implants are oral and maxillofacial surgeons. I am biased. That is the field that I am going into. Another type of dentist that place implants are periodontists. And then general dentists can place implants as well. The problem is there is no standardization between these groups of people and their training. Every single dentist, every single oral surgeon, periodontist, general dentist, they all have different training they have gone to. Just the regular 4 years of dental school does not set you up to place implants. You have to go out and get extra training. You have to be studying on your own. And so it's going to come down to the individual person. You need to ask certain questions like, what type of continuing education have you gone to? Did you go to residency training? Oral and maxillofacial surgeons go to the longest type of residency training, and it's 4 years in a hospital, where they do surgery that is far, far more complex than an implant. They can also put you to sleep. They can provide deep level of sedation, which the other types of dentists cannot do. Periodontists do a 3-year residency training, and something that they do is implants, but not every periodontist may have placed a ton of implants in their training. And then general dentists, they can go to weekend courses at hotels or different dental schools, and they can get a little bit of knowledge about bone grafting and about placing the implant. But if you decide you want an implant and you just go to the nearest corporate dental chain, the quality is not going to be the same. I'm telling you this right now. Okay, I advise you, and I understand that money is an issue for a lot of people. Dentistry is expensive. It is. I wish it wasn't as expensive. I wish it was more available to people and attainable to people. But the fact of the matter is you are 100% going to get what you pay for in dentistry. Let's say a dentist down the road at a corporate dental office, he or she will offer an implant for $1,000. They'll place the screw, they'll restore it with the tooth on top. $1,000 out the door. The other guy down the street, an oral and maxillofacial surgeon, he can put you to sleep. The fee to put you to sleep is $600-$700, whatever. He will place the implant for $1,500 to $2,000. He will not finish the implant. Your regular dentist is going to finish and restore the implant with the tooth on top. Implants can go disastrously wrong. A good doctor, what they're going to do is they're going to take a 3D x-ray. They're going to study the x-ray. They're going to look at the amount of bone you have, the vertical height, the horizontal height. They're going to be palpating in your mouth where the implant is going to go. And ideally, they've placed many, many implants before. They're going to look at vital structures around the implant. If it's near a nerve, if it's near a concavity in the bone, so it doesn't jut out the side of the bone. And they're going to be able to evaluate if you're going to need a bone graft to make sure the implant does what's called osseointegration. It fully heals and stays in the bone. There is a lot of science behind implants. And the average dentist that's just a Joe Schmo, they may say, oh, there's nothing to it. I'm just placing an implant. But the reality is, this is a prosthesis you're getting. It's surgery. It's requiring manipulation of the bone. You need a professional to do this. You don't need just any person. So that $1,000 implant, if it gets messed up, let me tell you what happens. If they place it in a angulation that's not correct, you're going to have that implant explanted, removed from your bone. You're then going to have a bone graft. You're going to have to wait 6 months for it to heal, and then you're going to have to try again at the implant. You could have complications such as infections, and not every dentist knows how to handle that. Oral surgeons do. In their training, they see all kinds of infections from inside the mouth to around the neck and structures of the head and neck. That's what they're professionals in doing. There's a lot of scam artists out there in dentistry, if I'm being honest. There's a lot of people that are not good at dentistry, that really shouldn't be dentists, but they are. You're going to have to do your due diligence to find out who the good quality dentists, periodontists, and oral surgeons are. And you need to save your money, and you need to go to the best possible person to do the job. You don't want to go to the Dominican Republic. You don't want to go to Mexico to get your dentistry done. And I know people that have done this or have talked about doing it. It's going to be a real big headache when you come back to the United States and you want to get the case finished, or you have a problem with the case. Nobody's going to want to put up with that. And if they do, they're going to be charging you a hefty fee to deal with your implant. Let's talk about braces for a second. So the idea is you want straight teeth, right? Everybody wants good-looking straight teeth. For a while, you could go get scanned at a mall, a company that is now defunct, I won't name, and they would send you the trays in the mail. This is possible for very simple orthodontic cases. So you have a little bit of rotation that's off, those can be handled via basic mail order things. However, if you move the teeth too quickly through the bone, that's literally what you're doing. You're pushing on the teeth in the ligaments and the neurovascular vasculature around the tooth, the ligament around the tooth. It's sensing that tension, and then it's literally moving the tooth through the bone, through inflammation and turning over of cells. If you do that too quickly, you can lose bone and you can lose teeth. If your case is a little bit more complex, and maybe you went to just a regular general dentist and they're in over their head, they think they can do every case imaginable, they could really screw you up very badly. Losing bone, losing teeth, it's possible. And then you're going to end up at the board certified orthodontist's office to have it fixed. And even amongst orthodontists, you need to be careful. You need to really look for the person that is after quality, not quantity. And with that, I hope you enjoyed this video. I haven't made a dental related video in quite some time. Most of my videos have been about politics, religion, things like that. And so I hope if you found this video, it is of some use to you. I hope I earned your subscription, earned your like, and earned your comment. Let me know what you think below. Until next time.